Good afternoon, everybody. My name is Sarah Connery. I'm the Director of Finance and Information here at Lincolnshire Partnership, and today I have the pleasure of presenting the annual accounts for 2019-20. In terms of a summary of the year, to start with some positives, we were able to achieve all of our planned financial targets. That's for revenue and capital expenditure. And as a result of that, we were able, as we did in 2018-19, to achieve a single oversight finance score of 1, which is the best it can be. This basically means we've managed to achieve a healthy financial margin, and we were able to manage our cash in a way that we can cover all of our debts as they fall due. I also wanted to take the opportunity to say, as a real positive from the financial year, is that we managed to complete our Brantward capital investment. So this is an investment of over £4 million in total, where we've redeveloped one of our older adult dormitory wards into single ensuite accommodation. This is a clear sign of the Trust reinvesting its past surpluses into improving patient care, and it's making a real difference for service users, staff and carers and families in the care of our older adults. Finally, I just want to highlight some areas of caution around our out of area placement spend in 2019-20. So the system spent 1.7 million over and above plan on out of area spend for acute and psychiatric intensive care patients. This is quite concerning, but the Trust has worked with our commissioning colleagues to work out a plan for investing that money back into local services. The Trust underwent significant focus around patient pathways, and to report that we're now back to normal operating levels in terms of our population and capacity, but more on this later. Also, in terms of our progress on community transformation, the system was successful in winning £7 million of additional funding to be spread across 2 years. We were not in a position to be able to invest all of the £4 million that we were allocated for last year due to the timing of the receipt, and also the need to properly engage all of our staff in how that money is going to be invested. But just to report that that money will be reinvested in future years, so it's not lost to the system. Moving on to key financial headlines for the year. This slide just demonstrates the key areas of focus that we go through each month at our Trust board in terms of how the Trust is performing against its key financial targets. So for 2019-20, we achieved an operating surplus of 1.5 million. You can see how that compares to 2018-19, but just to make colleagues aware that our year-end position is really driven by some of the bonuses that were able to be drawn down in 2018-19. So it was a 3-to-1 regime. That wasn't in place in 2019-20, which explains quite a stark difference there. In terms of capital expenditure, you can see that the Trust has invested a significant amount of its cash balances, so quite an increase from the previous year. So that's 5.3 million in total. A great deal of that, 2.9 million, was on the Brant scheme that I've previously highlighted, but also investment in improving our community services accommodation, which is also key. Our cash balances remained healthy, so we closed the year at 19.5 million. In terms of cost improvements, we delivered 94% of our plan, which is very positive. But as a word of caution, only 50% of those were recurrent. And it's key that of all the cost improvements that are achieved, that we aim to make them recurrent to maintain that efficiency and productivity. So this is something that our board and our Finance and Performance Committee have really focused on in the year. In terms of NHS improvement targets that have been met, we achieved our controlled total surplus, but we were unable to meet our agency spend cap of 2 million. We did breach it by only £14,000, but still it's an area that the trust needs to retain quite strong control over to ensure that we're able to work within the cap. But our board is committed to ensure that patient quality services come first as opposed to achieving the cap, which is part of what's driven that performance. I'd like to take the opportunity to thank all of our budget managers across the trust for helping us to achieve this very positive performance. As we all know, NHS resources are becoming ever tight, but I just want to say a big thank you to all of our budget managers to help us to get to where we have at the end of another successful year. Looking ahead, I just wanted to highlight some continued areas of focus looking forward. So an area that we continue to work closely with our commissioning partners is on delivery of the mental health investment standard. This is to achieve that we have parity of esteem with acute physical healthcare services. Also, one that we need to keep in mind given where we are is post-COVID-19 and how that's going to impact on demand for our services and what that might mean for investment in our services. As I sit here today, it's not entirely clear what our financial allocation or financial regime is post 1st of October 2020. So it continues to be an area where we need to work really closely with our commissioning colleagues. Also, we're awaiting the outcome of a bid to Treasury for £37 million of capital to help us eradicate dormitory wards. So this is going to be a really exciting opportunity if we are successful to improve our patient accommodation further. In terms of operational delivery, we're working hard at reinvesting out of area spend to ensure that we're at zero appropriate out of area placements by 31st of March 2021. And as mentioned earlier, we continue to transform our community services. In terms of collaboration moving forward, the financial regime is going to be one of more system control. So in terms of revenue and capital, we're going to be held accountable as a system for delivery of financial targets. And as part of that, we're working really closely with our system partners in joint development of business cases going forward. So that's my roundup of 2019-20 and a look to the future. So I'm happy to take any questions. Thank you.